everyone. Good evening. This is Mary Rios. I am Regional Director for New York, and I want to welcome everyone officially tonight to this very exciting call that we have. Tonight, this is going to be Medicus Global Opportunity webinar. To thank the person who invited you tonight, because this opportunity tonight is going to change your life. This is something that I personally want to tell you that is so exciting, and I am very glad personally that I have been involved since July. And we are a company that is exploding everywhere we go. I'm very, very excited to the things that are happening. I'd like to personally thank our corporate team because they endlessly work round the clock pretty much. Our CEO and president and chief at the helm, Rossiter, along with Jennifer Chamberlain and Ricardo Garcia and Savannah, and as well as James Camaro and Linda Helen, who is heads up all of our regionals. She does an amazing job. And I want to just thank personally how tirelessly they all work. Tonight, I want to remind everyone that is already part of Medicus Global. Tonight at midnight, this will end our promo that is going on right now, the 2-for-1. This is a deal of the century. It is awesome for all of the MedTrack new people that come on board. They get a voucher to sign up a person of MedTrack stature free. It's amazing. And so tonight, whether you're going to upgrade or whether you're coming in as new, you will receive a voucher to begin your new business. And it's just another opportunity that Medicus Global gives us to breed our success and bring us to a place where we can just grow as whatever pace we'd like to do. So tonight I have the privilege and honor of introducing one of the strongest, most equipped women I know. Her name is Michelle Russell. She resides in North Carolina. She is a regional director with Medicus Global. And personally, I have to tell you, I've come to her the last few months, and she is exemplary, not only as a professional businesswoman, but as a woman who adores her family. She is tirelessly taking care of them, and she even made a comment once to me that said that she is a domestic goddess. And I would say yes and amen. Yes, you are. It's amazing. After having 25 years of experience in network marketing, she leads her team with excellence and causing all of them to have an even more desire to be more successful themselves. So we have the privilege of having Michelle with us tonight, and she is going to do the opportunity presentation. And I warmly welcome her to all of you tonight. I give you Michelle Rudisil. Are you there, Michelle?
I'm here, Mary. Can you hear me clearly? Okay, well, thank you so much. Hey, thank you much for that kind introduction. You know, Mary, I want to just throw right back at you. I admire and respect you, what you bring to this this opportunity, to this business. You know, your leadership is just it's outstanding, and it's an honor to work with you and lock arms and just to this journey with you. So thank you, my friend, the nice, kind words, and welcome everyone. As she said, my name is Michelle Rudisil. I reside in Carolina, and I have been in this business for, you know, some time now. I fell in love with direct sales when my children were very small. I have three beautiful adult children, one with special needs. So this industry of network marketing, you know, really appealed to me because I could, you know, still be the one that I wanted to be that stay-at-home domestic goddess, as Mary referred to me as, and that was my title, and a title I'm very proud of. My kids used to laugh and say, stay at home, yeah, domestic, not so much. But, you know, truly, it was an honor to be able to take care of my children. We have our son, who is actually 27, still lives with us, has special needs, and my husband and I have devoted our life to making sure that we take care of him. So, you know, that's why I love this industry, and I love to have the opportunity to be with a company that will provide the income and provide what I need to stay home with my children. So, you know, folks, for the next minutes, I just want you to relax, buckle in, kind of turn off your distractions, and I'm going to just go through and share some information with you, that could possibly make a difference in your life. And so here we go, and we thank you for joining us. Because let me say this: we know there's lots of places you be on a Wednesday night. You've chosen to be with us, so I thank you for that. So, what does it mean to be part of Medicus Global? Well, you know what it is? You can be part of a multi-billion-dollar industry. It is truly one of the fastest growing industries out there. And what Medicus does is we're about bringing the best healthcare to every person, and the convenience too. I learned a long time ago that if you can find a void in the marketplace and you can figure out how to fill that void, then you're in the right place. And that's how I want you to position your minds tonight as we go through this, because Medicus Global runs a multifaceted virtual medical clinic. And we have business opportunities like telemedicine, special pharmacy, lab testing, business to business, toxicology, and pharmaceutical grade skincare. And I'm going to get into each of these with you as we go on. But before I start that, I want to talk about who's actually leading this company. Talking about the individual who's making a difference and who really has is working tirelessly to make sure that our mission of global expansion continues. This gentleman, Stephen Roster, our CEO of Medicus Global, his vision for telemedicine and actually opening the doors for preventative medicine, people a better option, is incredible. And I spoke with him earlier, and he was talking about there's just not enough hours in the day. Everything that he set out and he wants to accomplish, because he knows there's a void in the marketplace. In and around today, we know what's happening to healthcare. It's unaffordable. And so what we're going to present to you is his vision and what he wants to do and where he wants to take Medicus Global with it. So let me go to the next one here. I want to tell you a little bit about our parent company. It's Call the Doc. Some of you in the business world may have heard about Call the Doc because they have been in business for quite some time. There's actually over 2 million users on their platform, and we're licensed in all 50 states. And I'm very proud to say that, it's a very customer-driven company, and we have an A+ rating with the Better Business Bureau. And that says a lot in the business world. So Medicus Global is just a spinoff of Call the Doc. And what's so amazing is the number of telemedicine patients that are going to be increasing. I guarantee you, if you think back maybe 6-8 months, maybe a year, you didn't really hear that much about telemedicine. If you turn on the news, if you open the newspaper, if you read the newspaper, you're going to hear about telemedicine. And they're talking about HR Magazine is going to be the top 7 benefits to watch in this year that we're in right now, and also 2017. So what Medicus Global we've done, we put together the finest professionals in telemedicine. They have the same mindset that we have. And then they brought in the best business-to-business staff, along with some of the legends in the networking world, which really creates the perfect storm. That's what makes up Medicus Global. And we have 4 different divisions, and it's all under one umbrella. We've got the telemedicine, we've got the specialty pharmacy, business, and genetic lab testing, and we will go through all of these as we continue on. So I'm going to start right now and talk about the products. Now, why telemedicine? I want you to think about this for a second. The American Medical Association says 70% of all the doctor's visits are unnecessary, and they could be treated with an on-phone consultation. But we don't do that. If we've got a sore throat or we've got an ear infection or whatever, the first thing we go to our primary care doctor, and chances are it takes us a little bit of time to go in, or we do the thing we don't want to do. Look at this picture. This is a room full of sick people. You go to the doctor and we're afraid to pick a magazine, or we're afraid to, if somebody coughs, or we don't, it's crazy. So, if you could figure out a way that you have to put yourself in that situation, would you find it to be a benefit? I really think you would. And so let me just explain to you how telemedicine works. Members, you're going to get a card, and members can call a toll-free number. The first thing you're going to do is you're going to speak to a registered nurse, and that nurse is going to assess your problems, and then she's going to connect you with a doctor. But before I move on, I want to talk about this for 1 second. If you called your doctor's office, would you be able to speak to a nurse if you just called the doctor's office? stars you wouldn't. And I guarantee you they wouldn't put the doctor on the phone. So right here, talking to a doctor within minutes with no exposure to others' ailments, and you're doing it from the convenience of home, I think all can agree that it makes sense. And it also, there's savings in the convenience. If you go to primary care, I picked up the phone and called right now, chances are they're not going to be able to see me that day. They may be able to, or they work me in. It may take 4 to 7 days. It could cost me close to $25 for that. If we go to a walk-in clinic or a 24-hour urgent care, they're estimating time is about 4 hours. We know it's longer. And the cost could be upwards of $500. And I guarantee if you go into urgent care, you're not even going to see a doctor. You're going to see a nurse practitioner. Emergency folks, nobody wants. Isn't that your worst nightmare? That you're afraid your children get sick in the middle of the night, afraid they've got a high fever, and you have to take them to the emergency room. You could be there all long. They're saying 6 to 8 hours. We've had so many experiences. We took my mother probably about 6 or 8 months ago to the emergency room because her doctor couldn't see her. They had some problems. And, we were scared. We were scared of the symptoms that she was having. We were in the emergency room for 12 hours. Now, they ended up admitting her, but I just want you to think about that, what that could have been. And the stress that it caused my 83-year-old mother was not worth it. Total time, 1 hour, you've got zero copay, you've got zero deductibles. Now, we can tell you the savings are great and the convenience is even better. The added values to this is access to a doctor 24 hours a day, 7 days a week. You literally have a doctor in your pocket. You have a card. You have access to them. Everyone's eligible. There's no pre-existing condition limitations here. Family plan covers anyone in your household. No restriction. You don't have to supply them with security or an EIN. You have a discount card because a lot of insurances now, they don't include the pharmacy part, but you've got a discount prescription card. And your prescriptions can be called into your local Walgreens or CVS, just as if you had gone to the doctor. Not only if you needed a note, they're going to write a note for you for your employer or in the school. And the best part of this is not only do they have English speaking, they have Spanish speaking nurses and doctors. There is no appointment necessary. There's no time spent in the waiting room, no copays, no deductibles, importantly, no hassle. All for $29.95. Yes, I said $29.95. That's your whole entire family. Now, you think about the value for a second. Your family having access to that for $29.95. Telemedicine is truly changing the way healthcare is even being delivered. I was on CNN or something last week. They were talking about there was a robot that actually went into a hospital room and it had a doctor on the little screen. The doctor wasn't there, and they were talking about telemedicine. That's a whole nother side to it. So think about it. If your product or service is beneficial, it saves people money, and it's convenient, you truly have a business. Now, we all do this anyway. We refer people to things, whether it's a movie, whether it's a restaurant, whatever it is, we refer people. Now, wouldn't it be nice to be able to refer someone to a that we know that they can benefit from, and we can make an income with it? And that's what can happen. For only $49.99, you can start your business tonight. And this is what you're going to be able to do. You're going to get your own personalized website. You're going to have an income report. You're actually going to have license bill. You'll be able to sell the telemedicine services that we're talking about. Very powerful. Forbes magazine talks about the baby boomers, and they tell you, going into your retirement years, if you don't have what you're looking for, in your retirement funds, your budget, they tell you to look for a network marketing company that has a product or service that not only would you use, but that you would tell somebody about and position yourself, and it can make the biggest difference. Well, folks, that's exactly what we're showing you here with this. And for those of you that say, you know what, I love referring telemedicine, but I heard about some other things you were talking about in the beginning, and you want to fast track your Medicus global business, we've created a starter package for you, and it's different. It's called the MedTrack, and there's lots of benefits to this. And I'll actually tell you, being a MedTrack consultant, you not only have the opportunity to market and earn income from our telemedicine, but you can also earn income from specialty pharmacy, from our lab testing, going into businesses, from our skincare, our pharmaceutical grade skincare, and of course our toxicology. And I'm going to go ahead and go through these services with you so we can kind of break it down. And we're going to start with the business to business. Most everybody, if you get a job today, the first thing they want to know is the benefits. And folks, I will tell you, if you're out in the working today, benefits have been dwindling. They really have. Employers are just cutting back. We were discussing that on a call earlier. But telemedicine has become one of the fastest benefits out there in the healthcare arena, and more people are adding it. And the reason why it makes sense to the employers and it makes sense to the employees. It can lower the absenteeism for companies. It could increase the productivity. It could potentially lower healthcare premiums to the company. And some of the additional benefits to the employees is, if there's a higher copay, a higher deductible, with the plan that they have, having access to the telemedicine side to be able to call those doctors, without having to make the visit, it's a huge benefit. The global telemedicine market is expected to grow in the year 2016 to $27.3 billion. So do you think maybe we've found a void? Do you think maybe we found a solution to this void? I absolutely know that we have. Another product that we offer to our MedTrack consultants is we do what's called DNA genetic carrier screening. And this basically identifies 80% of all recessive diseases, things like cystic sickle cell anemia. And, those occur in families, and there's with people with no known family history of this disease at all. There's no indication, that anyone's carrying this disease. But most insurance cover the carrier screening test for people that are reproductive age, 45, because think about it, it would help them have the knowledge. And let me explain something to you folks. This is preconception. This is pre-anything. We're not talking. We're give people what their marker is and some knowledge, so they can make a decision for themselves. Basically, how this works is our MedTrack consultants, we actually help set up doctors' offices, and so that they can provide these non-invasive screening, and we make an income by doing just that. Our second test is the hereditary cancer screening. This is a non-invasive cancer test analyzing 31 genes to 8 of the most prevalent and serious solid tumor cancers: breast cancer, ovarian, pancreatic, prostate. You go on, and this is home to me because I am a breast cancer survivor. There was no one in my family that had breast cancer, and we could start guessing how this happened. But just imagine if I had knowledge prior to that, because it was a shock to my family. It really was. And I'm very fortunate to beat breast cancer. As part of my family, my son actually had leukemia. So, no known person in my family had leukemia. So you can see how having these pre-screenings can make it. We actually heard about this years ago with Angelina Jolie. Everybody thought, oh my goodness, she's a movie star, she can afford to do this. And she made some big decisions for her because she was predisposed. But now guess what? This is a level playing field for everyone. This is something that everybody's entitled to. And now that the doctor's offices, if they're able to provide them, the insurance companies are encouraging that you have them, because guess what? Knowledge power, it makes a big difference. Our test we offer is toxicology. And this is a scientific study of adverse effects. It involves observing and reporting mechanisms and detection. Now, we have probably read about it. The abuse of prescription drugs is crazy. It's one of the fastest growing problems in our country today. Every 15 minutes, a person dies from a drug overdose from prescription drugs. We're hearing about kids, we're hearing about adults, we're hearing about everybody. So just imagine having access to this. And 3 out of 4 deaths equate to 15,000 deaths. And what we're talking about here is our MedTrack consultants have the opportunity to able to market FDA-approved specialty pharmacy products. Now, what's specialty pharmacy? That's any pain that can be treated with topical pain relievers, whether it's wounds, surgical creams, migraine solutions. You're hearing more and more of these. We were on a call, and they were talking about topical pain relievers for truck drivers because they can't have anything narcotics, but they need the pain relief. So again, Medicus Global is on the cutting edge. Medicus Global is allowing the MedTrack consultants to have an opportunity to have that medical office, to be able to set this, to offer this. Now, what does this mean? To have your virtual medical clinic, what does it mean to you? Well, you're going to get equipped with a MedTrack pack, and you're going to have a logo laptop case. You're going to have a tablet that's loaded with marketing materials and a flash drive. So basically, you're ready to walk out the door and start your business. You have lab presentation package. You're even going to get a little demo so people see how we actually do this non-invasive test. You've got the telemedicine business-to-business pack, and they will even include in this pack, they're going to give you 5 monthly telemedicine vouchers that you could gift to someone so they could try the service at no cost to them. Because we know once they use it, they're going to continue to use it, and that's going to provide that residual income to you. You can even gift the business, the $49.99 a voucher for that. You get your business card, your logo, you replicate a website, and we do have training. You're going to be certified, you're going to be trained to market and implement these programs so you know what you're doing. We've got, and you've got access like this to the Medicus University where you can have ongoing training for yourself. Folks, if we were talking about a franchise, and I want to stop here for a second because when we talked about the affiliate side, going and making that income and providing that residual, but there's a lot of people out, this is almost like the something that you could do on your own pen. You can make plus figures a year just on this side of the business, whether you decide to share this opportunity with anybody else or not. We know you're going to, but that's pretty powerful, and you can position yourself for only $1,500. The value is almost $5,000 for what they are including in this pack. What I like the most is that you have a choice, of what you want to do and how you want to position yourself. Now, we're talking about building a business and, talking about income. And I will tell you that, we're not making any income claims. And while there can be extraordinary incomes earned with Medicus Global, the program, your earnings are dependent on you. The number of sales, the referrals, what you personally produce by your team's efforts and yours. So we want to make sure everybody is very aware of that. And we do have a lucrative compensation plan. And we're going to share a little bit of this information with you so you have an idea of how you can position yourself to have additional income without an additional boss. Now think about what I just said, additional income without an additional boss. You refer somebody, you pay the $49.99, you get the services for yourself, and you refer someone to these services. They sign up for $29.95 plan, you're instantly going to get $5 on that. Well, the next part is what I like because you get a monthly commission as long as they stay on your book of business. You get $5.75. Now, I mentioned residual income before, and folks, if you don't have residual income in your life, you need to get it in. Basically, what that means is you do the work one time, and you get paid over and over and over and over and over again. That's powerful. That's absolutely powerful. You do that. You even get paid for people that fall in your team that you didn't actually bring in. What you need to do to open up our compensation plan is you need to refer 2 people to our program, whether it's an affiliate and a customer, 2 customers, or 2 affiliates. That basically opens up your vault. That opens up your ability to make commissions with Medicus Global. Now, that's just highlighting the affiliate side. If you see the opportunity for yourself where you can go out and you say, you know what, absolutely, I want to go in and I want to share this information with doctors' offices, get the labs in there, be able to make money every time a lab is taken, a patient comes in there, then you can position yourself, and this is a limited time on this, 40% of the product payout that you could make on your personal, if you set up a doctor's office, guess what? You're going to bring somebody else in the business, and they're going to want to do the same thing, and the company's going to pay you 15% of their product payout. And it goes, again, to the next line where 5% of that's paid out. They're even going to pay you bonuses for bringing a first-time order bonus for bringing in a MedTrack pack and helping them get set up in business. So, it's really up to you. I don't know where you fit in. We tell people to get in where you fit in. I don't know if you're looking for additional income. I don't know if you're looking for an absolute career change. It's totally your choice, your decision. You can make whatever you want to. That's why I love this industry. That's why I love partnering myself with a company that's providing services that we know the masses need. We know that they can benefit from this. We know from the medicine to allowing these doctors to have cutting-edge information to their patients so that they can make it well. And let me tell you what's so exciting. You heard Mary Rios talk about it earlier on the call. This is really exciting. We're having an early Black Friday promotion, and actually it's in tonight at midnight. So you're in the right place at the right time. If you hadn't made the decision, if you want to upgrade, came in as an affiliate and said, you know what, I see myself doing this, and you want to upgrade, you have the ability before tonight, Eastern Standard Time, to pay that $1,500, but you're going to get a voucher to enroll a new person to be a MedTrack for free. Yep, you heard me. I said free. Imagine what 2017 could look like if you had a partner to run with, if you had somebody that you knew was going to run with this business. I mean, a 2-for-1 is absolutely incredible, folks. We will highlight this a little bit more at the end of the call because we're winding down and we've got a guest speaker coming on. So, what I want to tell you is there's so many promotions. There's so much stuff going on. And, we talked about a lot in the last few minutes. But I will tell you that probably one of the greatest tips that I was told years and years ago is, if you're involved in something, you need to see what's happening. You need to go where the action is. And you can see right on the screen, we're going to have the Medicus Fast Track holiday event that's coming up in the first weekend in December. And I want to invite all of you, go ahead and make plans to be there in just a couple of weeks, because what happens, it goes from your head to your heart. When you're around the people that are making it happen, when you're around the people that have the vision and have the determination to do and make it happen. And you can see right here our president, our CEO, Mr. Stephen Rossiter, he's right there. Our event tickets are $129 for any individuals that come in. You can actually sign up 3 new MedTracks and you can get in for free. But the coolest thing is this gentleman right here, the first 2 members, and we still have time, that get $100,000 in all new business with a Call a Doc Business Lab. He's going to take you on a shopping spree. And, I mean, how much fun could that be? I don't know about you, but I would love to go on a shopping spree with our CEO. I would absolutely love it. So you know what, folks? I gave you a lot of information, and we are so excited that you took time to listen. So what I want you to do is I want you to hang tight where I'm going to bring on somebody to actually close this call out. But, when the call ends, I want you to get back with the person that invited you to listen to this presentation and just let them know where you stand. Let them know where you see yourself fitting in, because this could be the setup for an amazing 2017. Amazing time. There's a lot of people right now going out looking for seasonal jobs. They're looking for different things to make money. You have the opportunity to make it now. So I encourage you, get back with the person that invited you, and let's get your business started today. Lock arms with us, join this journey, and be part of the Medicus Global family. So I appreciate you listening. Now I get the distinct honor and privilege of bringing on our guest speaker to close this call out. I spoke about him earlier in the presentation. You got to see his picture. You heard about going on a shopping spree, with him. But more importantly, I've had the opportunity to shake his hand, to hug him, to meet him, and his passion and his determination and his vision for what he sees and what he wants to accomplish with all of us is incredible. And so without further ado, I'd like to turn the call over to close it out to our CEO, our president, Mr. Stephen Rossiter. Stephen, are you on the line with us, sir?
Yes, I am, Michelle, and man, what an amazing presentation. Ladies and gentlemen, you are absolutely just received probably one of the most amazing opportunity calls that I have listened to yet. Michelle, fantastic job. Mary, great introduction coming into this. And ladies and gentlemen, when you think about opportunity, we all see opportunities, and opportunities come at a lot of different levels. I've had that experience my whole life. Linda Helen, who's our VP of Regional Directors, she's on the call right now as well. Linda is a truly amazing person, and actually, she sat right in front of my desk many times coming down into Plant City, Florida to our corporate office and sitting countless hours going over different things, and it's all about helping people. I was so inspired by Linda, and I wanted to just share that with you because, one of the things that I've always been a part of as me as a person, let's take business out of the equation for a second, is I just like to help people. Seeing success of people, there's nothing more that brightens my day. And to be able to make money at that at the same time, that is an absolute plus. And that's what you're looking at here. And one thing that I'll give Linda credit for is she opened my eyes on sharing more about myself than what I used to do. Okay, business was business, personal was personal. But, you know, I have three adopted children. Three adopted children that are all from outside of this country, that I just said, you know what, we'll help. We'll see what I can do. And each and every one of them have become some of the most amazing people in this world. Omar, playing professional soccer in Germany. My oldest in the U.S. military, now in South Korea, serving for the United States. And my youngest, 14 years old, currently still working his way up to the U.S. national team in soccer and becoming amazing people. And just the success is just tremendous. And as I look at everything that I do, you know, even going with Medicus Global and the vision behind what we're doing, you know, my grandfather passed away from prostate cancer, and I was a very young age when he passed away, but he was so full of wisdom. We all know that with our parents. We all know that with our grandparents. I mean, just so much wisdom and so much knowledge that you just wish you could still tap into, but they're not anymore. You know, they're not there anymore. And you always ask the question, could there have been something else that could have been done that would keep them at that dinner table at Christmas time, or at that dinner table when you're having the birthday for the grandkids or what have you. And you always ask yourself that question. And, you know, one of the biggest people I miss is all of my grandparents. You know, and my grandfather, Edward Rossiter, which is my dad's dad, when he died of prostate cancer, you know, at the time I was young, I didn't really understand it. And as I moved into the medical arena and as my vision developed, it's not so much about building something that's just going to make everybody a ton of money, but it's also building something that really changes the way that we see things. Technology is there. Ladies and gentlemen, technology is right in front of you. It's not a myth. It's not a, well, we have to try it out. It's not that we have to see how this works. It is here. The opportunity for you has came now. And if you're on this call tonight, there's a reason why you're here. And this is recorded. So if you're new here tonight, get the recording and share it with more people. It doesn't matter. If you're one of our associates right now and you get this recording, share it. Because, ladies and gentlemen, we can keep family here longer. We can keep friends here longer. With the lab testing that we have for our MedTrack consultants, yes, it's amazing how much money you can make. You will change your financial freedom. You will change the way you live without a doubt. That's not a question at all. But imagine doing that and still saving somebody's life just from a mouthwash. Okay? Just from a mouthwash. That's as simple as it is. If this doesn't get in front of as many people as possible to see what the potential is and see how we can change lives, then we're all not doing our part as human beings. And that is the way that I see things with this. You know, with a newborn child being born into this world, if there is technology there to tell you from 61 different diseases and genetic mutations from recessive genes that come from a mouthwash, that's it. 1 minute, you take a mouthwash, you now know 61 different diseases, whether you carry them or not. And you know, most come from people who don't know their family history. So to have that knowledge, knowing that you bring a child into this world, knowing that you're just at as much risk as the rest of the general population, is what every parent wants. Okay? The technology is here. Okay? Specialty pharmacy with prescription drugs. If you're looking at prescription drugs, you look at the #1 leading reason for drug overdoses in the world today is from prescriptions, not from illegal drugs. All illegal drugs combined still don't add up to prescriptions. That's where there's two parts to this. That's where our specialty pharmacy helps, and our toxicology reports. Everybody has different metabolisms. When you learn about toxicology and you understand what you're doing, you're saving lives. Just the most common person who may get in a car accident and start taking pain medications just to get past the pain, maybe until their next surgery, doesn't realize the severity and the worry they should have and the responsibility they have to pay attention to how their body is digesting and processing those pain pills. Because if your metabolism is low, you're not processing them as fast as somebody with metabolism is high, and they start adding up in your body and can cause you to go to bed at night one night and not wake up the next morning. I know that's real life situations, but that's what toxicology does for you. The PGX, the lab testing for PGX, is mental health. I mean, that is something that is the first thing in the mental health that they do, and these are all done so simply. Doctors love it, and less than 7 or 8% of doctors' offices in the country today even know about it. Next generation sequencing, remember that, okay? Next generation sequencing is one of the big parts of our labs. Our specialty pharmacy is amazing because it gets people off of the pain medications and gets onto something that has relief. I always use the testimonial of my own dad. You know, Michael Rossiter, he's my dad. He's my soldier. My mom is my, my rock. My family's very close. Those of you who are down in Sarasota with me, you know that family is everything to me. And I look at my family every day just worrying for that day to come that maybe they won't be here anymore. What can I do to help them? So I look at my dad. My dad had some very, very bad back pain, okay? Very bad back pain. He couldn't get up and walk. And my dad loves to play basketball. He rides his bike 10, 12 miles a day. And he's hit 70 years old now. He's getting to the age to where, he's got to pay attention to things. Well, he was immobile. He was completely immobile, could not get up, and it broke my heart. And I said, Dad, just try this. He doesn't like taking pain medications. He doesn't like doing anything. He's the type of person, we all know these people in the family, that, you know what, I'm just going to ride it out. I'm going to ride it out. I'm going to wait 3 or 4 days and then maybe jump on with a doctor or something later and see what I need to do. But I gave him one of the topical creams that we have, which is our lidocaine 5%, which there's no risk for that. It's topical. You place it on there. And I said, Dad, just try it. Trust me. And he says, okay, you know what, I'm going to try it. It's nothing oral. I'm going to try it. He placed that on his lower back where his problem was. And, when the pain came back, he placed again, and the pain came back and placed again. And I wasn't there for a couple days. And 3 days later, he calls me, and he says, hey, I want to stop by your office. And I was like, okay, yeah, come by my office, please. Stop in and say hello. And, I'm thinking to myself, wait a minute, he's driving? And he came into my office, and he said, that stuff works very, very well. He says, I'm actually very, very shocked. And I said, you know what, Dad, I'm going to use you as a testimonial as long as this company goes on the specialty pharmacy, because he's the most honest person I know, as honest as the day is long, 30-day retired law enforcement, works with the FBI, definitely works with the state of Florida for mortgage fraud, credit card fraud. He's all involved, and he is just the most honest person I know. And for him to say that I was just like, wow, okay, well, this is fantastic. And it is a true, amazing testimony. Another one that I want to give you is from the telemedicine side. We look at the telemedicine side. We've all been in the situation where it doesn't matter when you need a doctor these days. You are going to wait. Average wait time in Boston, Massachusetts, 40 days. That's 40. In the metropolitan area, Boston, Massachusetts today is 40. 40-day wait to see a care physician. 36 days in Los Angeles, 3 to 7 days on average across the U.S. We're now comparing to second world countries and socialized medicine countries. The United States is in a really big problem, okay? Doctors are retiring faster than they're becoming doctors. I want you to just hear all these things because of the opportunity that's here. You have a market. You have the ability, if you'd like to come in at associate that's just paying $49.99 a year, that's it. You're going to get your website, you're going to be able to sell, and you're going to do great. But if you're among those people who want to go out and really change their lives, coming in as a MedTrack consultant, you have so many different parts of the business that you can really market heavy and make a tremendous amount of money. Some of the testimonials that I see just on the lab side, I had somebody that came in, and I try to pull as many as I can, but we're growing so fast that I have all of our VPs and our employees coming in sometimes to say, hey, you got to hear this success story. There was one of our associates, I won't mention the name, but one of our associates went into a doctor's office, our MedTrack consultants went to a doctor's office and said, look, I brought 3 doctor's offices in today. It took me about 5 to 10 minutes per doctor's office. And then I said, okay, well, that's incredible. And I said, how'd you do it? And, this person said, actually, I just made a phone call. They actually didn't even walk into the doctor's office and signed 3 doctor's offices up and now have changed their entire income of their whole life for this. Okay, and as we add more products onto the labs, as we add more stuff with specialty pharmacy, as we add more stuff with skincare and business to business and health fairs, this is something that has a 20-year plan ahead of it. You're not coming into a business that is just trying something out. This is medical necessities, ladies and gentlemen. This is stuff that absolutely will change the way that people live today. When you have something as powerful as this, and you hear the passion in my voice, you've heard me talk about family and all these different aspects, that's because it's so real. Do research on myself. Do research on the business. Look at telemedicine. Look at genetic lab testing. Look at specialty pharmacy. Look at everything that we do. They're medical necessities. And we are disrupting the market. You know, I'm going to close out with just this. I'm going to go about 2 more minutes, and that's it, ladies and gentlemen. You know, disruptive marketing. Think about that as the new era of marketing. Kevin Young, our VP of Corporate Development, speaks about it so much in shared economy and disruptive marketing. But, you know, if I just give one example, just look at Uber. Uber's a $64 billion company in 5 years, and they don't own a car. They don't own a car. Think about that for a second. Okay? Medicus Global is a turnkey digital medical clinic, and we don't own a doctor's office. Okay? We don't own a lab. We are a marketing arm of this. We give the ability to pull all these technologies together, and what you see that's coming out over the next couple of months as we continue to build this is amazing. Our attorneys have even said, never seen anything like it. Our physician side, unbelievable. Some of the doctors that are coming in on the telemedicine side decided, you know what, too much liability to own my own office and have a staff of 20 people. I'm just going to do telemedicine. Okay, I'm going to handle 70% of doctors' visits. Okay, think about a country with 360 million people and 70% of doctors. That's a lot of doctors' visits. Okay, over 5,000 physicians nationwide. That's in our network for telemedicine. That's on our network for Medicus Global. Okay, so you have a less than a 10-minute wait time, anytime, any place, anywhere that you're at in the U.S. We offer the most highest technology, next-generation sequencing of genetic lab testing that's out there, toxicology and PGX as well. We have the most highest grade A, FDA-approved specialty pharmacy products that you can get on the market today, and the most highest pharmaceutical grade of skincare products that are here today. I encourage you to come to the December event because you are going to learn an amazing part of this. And those of you that are wanting to see more on the skincare side, you're going to see so much on this. So, ladies and gentlemen, it's now 9:42 p.m. Eastern Standard Time, and you ask yourself, why am I on this call? I'm looking at record numbers and participants right now, and I'm seeing the number not going down, so I know that you're listening to this. Okay, I know that you hear the opportunity is there. Ladies and gentlemen, if the opportunity is there, as good old Richard used to say with Virgin Airlines, if the opportunity is there and you don't know what to say yes and figure out how to do it later. You will not be sorry for this, ladies and gentlemen. The time has come. This is where you want to be. The person who brought you here is going to be your best friend for the rest of your life because we already have the success stories. We already have people changing their lives. We already have many doctors' offices coming on board, changing lives in the prescription world, helping people get access to physicians. Nothing worse than being sick, waiting 3 to 5 days to go see your doctor, and what could have been treated with amoxicillin is now treated with 3 days in the emergency room and a $5,000 deductible bill. So think about that for a second. And this is very, very easy for you. The training's here for you. The opportunity's here for you. And ladies and gentlemen, you have came to the right place. Medicus Global is changing and providing the future of healthcare across the United States and across the world. I have spent time traveling into multiple different countries, meeting with multiple prime ministers of health, ministers of health and prime ministers, and speaking at different events in Europe, as well as through South Africa and South America. It's tremendous on where you're at. And right now, you could join tonight. If you want to just test the waters, hey, pay the $49.99. Not a problem. You'll see the telemedicine. You'll have the service as well. Everything is fantastic. But don't forget, we're closing a promotion tonight. Buy one, get one free. What does that mean to you? You buy a MedTrack consultant for your $1,500. You're in the business. One doctor's office, one little step forward. It'll take you less than a week to be able to do that. You're going to make your $1,500 back without even a blink of an eye, and you're going to change your life after that. But you'll also be able to bring somebody else into the business for free. You'll be able to give them a MedTrack consultant, and you've already started building your team of people to be able to build an army now to work with this, which you will benefit from as well. So with that, ladies and gentlemen, we will change lives together. I hope to see everyone possible here in Plant City, Florida in December. We have such amazing things planned for that. I'd love to shake hands, give you all hugs, and let you meet some of the amazing people with our labs and specialty pharmacy. And, you know, we talk about Michelle that was just on this call. What a fantastic job. Linda, our VP, James Kamara, who tried to be here tonight, but he couldn't make it. He's our VP of Sales and International Expansion. Kevin Young, who is still here with us. He's our VP of Corporate Development. We actually have the entire corporate team on the call right now. So with that, ladies and gentlemen, I thank each and every one of you so much. I'm proud of absolutely every one of you, and we hope to see you here very soon. Remember, it's 9:45 p.m. We got a little bit of time left today. A lot of emails also went out today for more calls tomorrow, but ladies and gentlemen, you've made the best first step now. The door is open. Take a step through that and join the team today. You will not be sorry. Thank you very much, everyone, and enjoy the rest of your night, morning, and day, wherever you're at in the world, and take care. Bye-bye.